we must make sure that they are accounted for and issuance and renewal of license. Then, of course, we do interagency coordination, Honorable Speaker. We do monitoring and evaluation, verification of all the systems, tracking payments, verifying compliance, in collaboration with oversight institutions. How is tobacco control being coordinated with the ministry and across other government institutions, especially in the context of devolution? Honorable Speaker and members, tobacco control in Kenya is implemented through a coordinated multi-sectoral framework under the Tobacco Control Act. And this is in line with the constitutional provision on devolution. So coordination is undertaken as follows. The national government, which is the Ministry of Health, provides the overall policy direction. It provides technical leadership and coordination of tobacco control programs. Then we have the interagency collaboration. The ministry works with relevant government institutions, including the ministries responsible for finance, interior, education, trade, to support the enforcement, the regulation, the taxation, and the public awareness. Then we have the Tobacco Control Board. The Control Board provides the intersectoral coordination and advisory support to ensure harmonized implementation. Then we have our county government role, which is for the implementation of the tobacco control activities, including enforcement of smoke-free laws, health promotion, and cessation services, which we work closely, very well with the county governments. And of course, we do monitoring and evaluation. Honorable Speaker and members, tobacco control is effectively coordinated through a structured national and county framework to ensure policy coherence, efficient implementation under the devolved system of government. Thank you, Mr. Speaker.
Senator Manzo, any supplementary question?
Yes. Mr. Speaker, I would like to ask the Cabinet Secretary, now that this House, the Senate, gave him very good regulations and the graphics last year to control tobacco use, one, how is he also reaching out to Kenyans consuming raw tobacco by their mouth and processed, which could even be more dangerous than the e-cigarettes and what people are circling like sweets. Finally, we've not seen those regulations in the billboards as we had given him. It's almost a year now. And how is he going to make sure that the accounting happens? He said in a week's time or 2 weeks. Could we kind of then maybe give him another date so that he can present the Auditor General's report on this and how the money, 700 million or so, has been used in this regard? I thank you, Mr. Speaker.
Honorable CS, proceed.
Honorable Speaker, I think the Honorable Senator for Makueni is in a better position to get the Auditor General's report. All that we get ourselves is a management letter. We provide all information. The Auditor General reports, is an independent office. It reports to the houses, to Parliament. So I think the Honorable Manzo, you can check through the Auditor General reports. But I agree with you. We must make sure every coin from the Celestian Fund is accounted for. I agree with you. And we had a session, and we have now enough money. Since I went there, I have stopped a lot of activities that were not inconsistent with the use of the fund. So we have, and that's why even up to now I have not constituted the board of the tobacco board, because I need to clean up and then see we get men and women of integrity. On advocacy, I think on raw tobacco, I think advocacy is for all tobacco products, including the raw tobacco. And I think the leaders can also help me that we also don't give raw tobacco to our voters. The way we better give them sugar and tea and unga. But in some places they are given raw tobacco, and he knows, Honorable Manson knows. So let's start from there, that as leaders, you help me in advocacy, because I agree with you, raw tobacco is more dangerous. But all tobacco, all types of tobacco, and tobacco accessories that come with, I think we need to advocate, and we need to make sure Kenyans are sensitized and they are told the effects. But Honorable Speaker, just to add, because tobacco is related to cancer, and I want to use the Solutium Fund mainly to upgrade the infrastructure of cancer facilities in our country. And I have started with making sure that we sign an agreement and pay for, from this fund, the servicing of all the cancer machines, whether it is linear machine, whether they're at our referrals, at our counties, so that at least they are serviced, they don't break down. We don't want to have a queue of our cancer patients, then they are told the machine has broken down. So we have agreed with our county government, particularly in the regional cancer centers, like Garissa, Mombasa, Nakuru, the one now at Jaramogi, Kenyatta National Hospital. We are putting some in Mwai Kibaki. All of them, we want to make sure that this Solutium Fund is used to pay for the service level agreement. Secondly, we also want to use this fund to build rehabilitation centers of drug addicts, government-owned, government-run, so that those of our young people who want to come back and reform, they have got very good facilities. They don't become victims of the private ones, which are run by private businessmen. So, and that's why I said we're doing one in Nakuru and one in Meru now. And I think finally we want to promote alternative livelihood. This will be a bit controversial in the regions where tobacco is grown. The growing of that tobacco, maybe they can grow rice, beans, instead of tobacco. Mainly in Migori, Busia, and Bungoma counties. So thank you, Mr. Speaker.
We now move to question number 025 by the Senator for Kisumu County, the Honorable Senator Tom Ojenda. Senator Hamida, you've been nominated to ask that question on behalf of the Senator for Kisumu.
Thank you, Mr. Speaker. Bwana Waziri, my question is, Senator Ojenda's question is 025. Could the Cabinet Secretary outline the measures in place to ensure that the Social Health Authority, SHA, processes and settles claims submitted by low-tier hospitals in rural areas and small private hospitals promptly, and with similar priority given to the settlement of claims from national and county referral hospitals? Thank you.
Honorable CS, you may proceed to respond.
Mr. Speaker, I just want to correct my earlier statement on this, on the Hansard. The 5 chronic counties, I want to correct it. Migori is not one of it. It's Kisii, Mandera, Wajir, Bungoma, and Homa Bay. That's where we have the biggest fraudsters, and they also constitute where we have closed more facilities. Honorable Speaker, the Social Health Authority has implemented a very robust measure to ensure that there is absolute equity in the processing and settlement of claims, regardless of the facility tier, regardless of the location of that facility, and regardless of the type of facility. Is it faith-based? Is it private? Is it public? Honorable Speaker, I want to say that claims are strictly processed on first in, first out principle. This means claims are paid as they are received from facilities. ensuring that low-tier rural facilities receive the same exact priority as our national referral hospital. So I really want to urge, and we have talked to, through our clinics, facility owners, and we have trained them that how claims are lodged is not how claims were lodged under the manual fraud-invested NHIF. Claims are lodged through a digital system, a digital superhighway. 2, our data confirms, and hospitals have confirmed, this equity function is in practice. And today, the settlement rate across all levels in the country is at 74% within the 90 days that this House has allowed us in law. The law says we pay all our claims within 90 days. But we are more proactive. Every 14th day of every month, we pay claims. But our claim level currently at 74%. In fact, Honorable Speaker, I was with the leadership of Tenwek Hospital, and they told me the claims rate in that hospital now is at 80%. Specifically, the settlement rate for level 2 facilities stands at, as a primary health care, stands at 73%. Level 3 facilities stands at 73%. And this is directly comparable to the 72% settlement rate for level 4 and 5. And level 6, our referral hospital, both public, private, and faith-based, is at 74%. To support cash flow for management for our small and rural facilities, the Social Health Authority has implemented a strict 90-day claims payment rule, and if possible, even do the 14th of every month, further, which we have been predictably been dispersing at the 14th of every month. And that's why I said from last Friday to this Friday, we are disbursed, and we have disbursed 13.5 billion shillings. If you look at the collection of NHIF, they used to collect between 3.5 to 3.7. That collection was for 5-6 months. So we know what we are doing and what we are saying. Honorable Speaker and members, at the PHC, we have paid all facilities up to January 2026. And the balance is because of exchequer release. Once we get that exchequer release, we will pay February and March and April. We have received also an additional 6 billion, with 2 billion for maternity services, and the balance 4 billion is for other PHC services. Why am I saying? When we had the summit with the President, the Council of Governors, and the President at the summit in December, we have agreed in principle that there are certain dispensaries and health facilities